All right, good afternoon, everyone. Can I please ask that everyone who is not speaking on today's call to put your lines on mute? You can do that by pressing *6. And we're just about ready to get started. Thank you all for taking the time to be on this webinar today on learning how to achieve a healthier campus through our Tobacco-Free College Campus Initiative Challenge. We have some wonderful speakers lined up for you today, who we will briefly run through right here. First off is Captain Elijah Martin. Elijah Martin works for the Office of the Assistant Secretary for Health and the Office of Minority Health here in Region 3, which is made up of Delaware, D.C., Maryland, Pennsylvania, Virginia, and West Virginia. And of course, he is a Captain of Commissioned Corps. His capacity as the Regional Minority Health Coordinator, Captain Martin has a focus on health disparities and supports various HHS programs such as vaccine outreach, ACA outreach, our Million Hearts Initiative, and of course the Tobacco-Free College Campus Initiative, just to name a few. After Captain Martin speaks, Cliff Douglas will be speaking. Cliff is the Director of the National Tobacco-Free College Campus Initiative, which is a partnership of the U.S. Department of Health and Human Services, the American College Health Association, and the University of Michigan. As an attorney, advisor to Congress, lecturer at the University of Michigan School of Public Health, and the Director of this initiative, Mr. Douglas has fought to end tobacco use and expose the tobacco industry's tactics. At the end of the webinar, Starla Stiles will be speaking. She works for the American Legacy Foundation as their Director of Communication. She's here today to discuss her work on their HBCU steering committee and the opportunities arising from that work there. And finally, I'm Joshua Prasad. I'm an ORISE Fellow here in the Region 3 Office of the Assistant Secretary for Health in Philadelphia. I work on chronic disease prevention through the Lessening Cities, Towns, and Counties Initiative, as well as the Tobacco-Free College Campus Initiative. So thank you all for being here today. Again, if you're not speaking on today's call, we ask that you please put your phone on mute. You can do that by pressing *6. So without further ado, here is Captain Elijah Martin to talk about our minority health focuses.
Good afternoon, everyone. I want to thank you today for joining us for today's webinar to talk about an important public health issue on tobacco prevention. As a Region 3 Minority Health Coordinator, I provide leadership and guidance in consultation with the Regional Health Administrator and the Office of Minority Health on all aspects of planning, establishment, direction, coordination, and advocacy of policies, programs, and activities that deal with reducing health disparities. I also represent the HHS Regional Health Administrator in national, state, tribal, and local meetings to gather information, develop key partnerships, and address minority health-related issues and assist state, tribal, and community-based and faith-based agencies in accessing federal resources and in designing plans and proposals compatible with federal policy. I am proud to share that I am a graduate of Fisk University in Meharry, and I have also worked at an HBCU, Langston University, for over 10 years as an administrator and a faculty member. I want to provide a few opening points about our goals in the Office of the Assistant Secretary for Health and the Office of Minority Health. Under the HHS Department, it is our joint goal to improve health of all people in the region and around the country. Our region is made up of a wide variety of populations, and this requires us to work at several levels through many different programs to increase our impact. So we better understand what we're doing, I just want to preface with the context of where we are coming from, and then dive into why fighting tobacco is so important. OMH has created the Disparities Action Plan. The HHS Disparities Action Plan has 5 key goals, as seen on this slide. Opportunities to address the Disparities Action Plan include providing leadership in implementing prevention as part of the healthcare reform by fostering collaborations with HBCUs on priority prevention initiatives such as the Tobacco-Free College Campus Initiative, and the reason for today's webinar. As a Regional Minority Health Coordinator, I am committed to developing a partnership with you to address tobacco use and smoking on HBCU campuses by working on the goal to get all 17 HBCUs in our region to establish tobacco-free campus policies by 2017 and address these issues related to emerging tobacco products that adversely impact racial and ethnic communities. We in the region, as leaders, both at the government and at your institutions, are interested in advancing the health, safety, and well-being of our population. To do this, we are transforming healthcare. Everyone has heard of the Affordable Care Act, also known as Obamacare, which is improving access to all Americans as well as insurance coverage, but especially minority populations who had greater issues. The Office of Minority Health is supporting the implementation of the Affordable Care Act by helping to connect minority consumers and communities of color with information about the affordable insurance options and partnering with the Centers for Medicare and Medicaid Services and other federal agencies and private sector organizations to support outreach efforts. There are a number of items about the health insurance marketplace that I could speak about that I hope that you are already aware of, so I'm going to just shift through a couple of the slides that you'll have to reference at a later point. As we look towards discussing how smoking impacts people of color, I think it's important to note that it is estimated that 1.6 million African Americans who are now under 18 years of age will become regular cigarette smokers, and approximately 500,000 will die of a smoking-related disease. And of course, the reason we're here, smoking and tobacco use, which affects minority populations in many ways. We can look at black populations in particular and see several major issues that we're struggling with. African American populations actually smoke slightly less, but are basically at the same level as white populations. While African American adolescents smoke less than their white and Hispanic counterparts, the rate of increase of tobacco use between 1991 and 1997 for African American adolescents nationally was 80% compared to the increase for white adolescents at 28% or Hispanic at 34%. As you know, and the reason, again, that we're even having this discussion, tobacco use is a major contributor to heart attacks, strokes, chronic lung disease, and cancer, and is one of the most preventable causes of death and disease for men and women. Tobacco use adversely affects the health of African American students and their families. 1 out of every 3 smokers will die prematurely, with an average of 12 to 15 years of potential life loss compared to normal life expectancy. Recent studies have shown that cigarette and cigar use, including flavored cigars, cigarillos, and little cigars, is on the rise and is highest among our African American and Latino youth and young adults. As I conclude, before we hand it off to Cliff, I want to note that African American males, as I am African American males, are dying at a higher rate than our white counterparts. There is a disparity there that we need to reduce. And with that, it is indeed my pleasure to introduce to you Cliff Douglas, the Director of the National Tobacco-Free College Campus Initiative. Cliff will go into much greater details about the negative effects of smoking, the need for tobacco-free policies, and why we're focusing on historically black colleges and universities.
It is, man. So, let me thank you very much for your earlier gracious introduction, Josh, and Captain Martin. I do want to give special kudos to for leadership in this effort and directing the effort from Region 3 for the Department of Health and Human Services. This has been a tremendous effort, which I'm looking forward to spending some more time talking about. And thanks to Josh for facilitating this, and also to Starless Files, my wonderful longtime colleague who is with the American Legacy Foundation, whom we'll hear from. She and Legacy itself are playing a key role as leaders in this effort and have, from the very beginning, been key supporters of the Tobacco-Free College Campus Initiative. And welcome to everyone who's tuned into this webinar. Delighted that you're with us. It's an exciting initiative. A very critical aspect of which, as you already know, is this focus on our historically black colleges and universities. And let me just say that with your commitment and action, we will continue to make tremendous strides in this effort. And in the process, we will prevent a great deal of avoidable illness, and we will save lives. Josh, could you go to the next slide, please? So let me just start with a little bit of backdrop. Captain Martin has done a terrific job of giving us some background on health impact and why we all care and need to care about this. I'm going to elaborate a bit here, talking not only about the challenges before us, which I'll get to in a moment, but also about the good news, because there is good news in the realm of tobacco prevention and control. We have a really rather remarkable public health history involved in this issue. First of all, as confirmed by the most recent Surgeon General's report, which was issued earlier this year, it was the 50th anniversary of that first landmark report released by Surgeon General Luther Terry back in 1964. We know that in the last half century, lower smoking rates have saved about 8 million lives in the U.S. And really, there's no other area of public health that we can look to that we can say something so dramatic about. Now, we know that in the U.S., average life expectancy overall has increased by about 10 years. And the most amazing thing about that, when you look at it from the perspective of the tobacco epidemic, is that because of the progress we've made, about 3 of those 10 extra years of life that the average citizen in the U.S. Is able to live, about 3 of those years is directly due to lower smoking rates. That's how fundamentally important this particular issue is, and it highlights why it is so important to focus on reducing tobacco use as part of our broader health promotion and disease prevention efforts on our campuses as well as across society. Next slide, please. But as you already know, let me just add a little bit of detail, because this is helpful as you pursue these efforts where each of you are on your campus, because a lot of what we do here is we deal with communication, we provide education. It's critical for people to know that contrary to the understanding of at least some folks out there, the tobacco problem, quote unquote, has not been solved. It's not time to just move on to other issues. A huge challenge remains, and that's the paradox. We have the good news, but at the same time, we know that since 1964, cigarette smoking has killed more than 20 million Americans, our brothers, our sisters, grandparents, uncles and aunts, friends and colleagues. And that includes 2.5 million non-smokers due to exposure to secondhand smoke, and also more than 100,000 babies due to such events as sudden infant death syndrome and the conditions of premature birth and low birth weight, which are direct results of smoking by pregnant women. Today, about 45 million people, including middle and high school students in the U.S., still smoke cigarettes. And cigarette smoking causes close to 500,000 deaths per year still in our country, even today. It also has enormous economic consequences, as you can see, with almost $300 billion being accounted for by medical bills and lost productivity directly due to cigarette smoking alone. Next slide, please. So this is the simple graphic, which is helpful for people, I think, to see, because it's very disturbing, but it makes clear how critical cigarette smoking is in the health of our nation and on our campuses. When you add up all of these very recognizable forms of preventable death, HIV, AIDS, and car crashes, illegal drugs, murders and suicides, alcohol abuse, And fires, by the way, a large percentage of fire deaths actually result from cigarette butts. All of those together total about two-thirds of the toll from cigarette smoking alone. Next slide. And when we look at our campuses, and this of course is the focus today, we know that based on current rates, the projection is that nationwide more than 1 million of our current college students will be victimized by their tobacco use, primarily cigarette smoking, but also other forms. And that's a number that's unacceptable, and that's why we are pursuing this initiative. Next slide, please. Now, when we talk about health among the African-American community, the numbers are pretty stark, and they're really pretty critical to understand. And Captain Martin has already highlighted some of this, but let me just share a couple of more details to fill out the picture a little bit. Again, as you know, about 47,000 African Americans die from smoking-caused diseases every year. More African Americans die from lung cancer than any other race in the United States. And menthol cigarettes, while they are not solely responsible, are disproportionately responsible for this African American tobacco-related epidemic. The leading menthol brands in the U.S. are Newport and Cool and Camel. They are the tobacco industry's most profitable cigarettes, and they are also, as you've heard and know, highly popular in the African American community among those who smoke, something on the order of 80% or so of all African American smokers use these brands. And we know through the Food and Drug Administration's review and other scientific data that menthol cigarettes lead to earlier and more likely initiation by kids, and also make it even more difficult to quit among those smokers who are trying to. So this is of great significance. Next slide, please. The industry's involvement in this is really pretty key. And the Surgeon General's report that was released just this year, all of these new data come from that report, show that the tobacco industry, while it brought menthol brands into the market way back in the 1930s, in the mid-century is when they began to really aggressively market methylated cigarettes to African Americans, and in ways that covered literally every aspect of life. And I'm, as you can see, quoting directly from the report, in black communities, from presence in black-owned publications, jazz concerts, civil rights groups, massive billboards, especially targeted in African-American dense urban areas. And the aggressive marketing of menthol cigarettes within African-American communities resulted in these persisting high rates of use of these brands in the community. And this has continued to this day. And as I've already noted, menthol cigarettes are implicated in making it more difficult to quit successfully among all of those African American smokers, the majority of whom say that they actually would like to overcome this addiction and quit. Next slide, please. The tobacco industry currently continues to fight back against any possibility that, for example, the FDA might regulate menthol cigarettes by doing what they've always done for decades. This is historically and traditionally the approach they take. The tobacco industry, in this case the Lorillard Tobacco Company that produces the leading brand of Newport, argues that this is a civil rights issue, that you should leave our menthol cigarettes alone because you're interfering with people's rights and their freedom of choice, as you can see, freedom of choice for grown folks. And they play a card which is highly inappropriate because it doesn't say anything about the health impact and the fact that there are hundreds of thousands of Americans and tens of thousands of African Americans who are killed by these very products every single year. Next slide, please. So it's out of this backdrop that in September of 2012, Dr. Howard Coe, who just recently stepped down as our wonderful Assistant Secretary for Health after 5 years, went to the University of Michigan and joined with the president of the university and the dean of the School of Public Health and other national leaders to launch the Tobacco-Free College Campus Initiative. The purpose of which was and is the widespread expansion of tobacco-free policies to institutions of higher learning all across the country, with specific goals of taking a collaborative and cooperative, and I should add supportive approach, expanding awareness in academia, but also among the public, of the need for and the benefits of tobacco and smoke-free policies, and also facilitating information flow, which is really, in many ways, what this whole initiative is about. Next slide. So, this is an image of the website which we launched alongside of the initiative in 2012. It's recently, at the expert hands of Josh Prasad in particular, been really wonderfully updated. It's very current. It links very tightly into the social media. As you can see, we have our Twitter feed there. The Tobacco-Free College Campus Initiative is on Twitter, it's on Facebook, and very media and communications oriented. But the reason that we founded this website was to serve as a one-stop source of information, a one-stop shop for all of the stakeholders, all of the folks on this call who are interested in this issue and pursuing it where you are on your campuses. We didn't supplant the many wonderful resources out there, but rather link to all of them, to feature them, not to reinvent the wheel, but we also provide a lot of original material and information here as well. And I encourage folks to please go there. We've got everything from on-the-ground oriented toolkits and how to do this to background peer-reviewed research, and we cover all of the major issues on the tips of everyone's tongue. Next slide, please. And this is just an image of our Facebook page, of our Twitter feed, and we would welcome you, if you haven't already done so, to please get on Twitter and like, or rather follow our tweets, and to like the Facebook page and participate. This is a very interactive process, and everyone who is joined on this webinar today is a key player. Next slide. Now, I love leading up to this because we have had really remarkable success in making progress on this issue since the launch in 2012. That wasn't the beginning of the process, but we've had really a terrific time being able to build on the work that had been done before and to really expand on it. And as a result, we have seen that in the first 22 months following the launch of the campaign, we've added another 598 colleges and university campuses with smoke-free policies covering the indoors and outdoors across the country, which is more than a 77% increase. We also see that about 2/3, which is remarkable in itself, of all of these policies are 100% tobacco-free, covering all smokeless tobacco products. And then a growing number, while it's early in the process, as you can see, 176 recorded as of the last report are now including e-cigarettes, electronic cigarettes, prohibiting the use of those products on campuses as well. And I would just say as an aside, by the way, that I've been working on this issue since coordinating the national campaign for the airline smoking ban, which seems like reasonably ancient history at this point. It was back in the late 1980s. So it's been a quarter century, and I have to say I've never seen any effort in fighting the tobacco epidemic in the tobacco control field that moves so rapidly and has so much success so quickly as we have seen with the college initiative. So I'm just delighted to be able to continue to move the ball forward with everyone who's joining in today. Next slide, please. This is just a very simple image. It shows what it looks like. This is our progress, dating back to essentially what is the beginning in this area, back in 2005 when roughly 20 or 25 colleges and universities had comprehensive policies, almost zero in other words, and now we're up to getting up near 1,400. Next slide, please. So this is an image, and you can see a brief public service announcement. It's important for a couple of reasons. So first of all, it highlights the commitment and action within the HBCU community. Rahsaan Roberts is the former head drum major, so kind of a prominent, almost celebrity student from this campus from between Cookman University and Daytona Beach. And he took the time to produce this small ad to highlight the issue and also to underscore the fact that the fully tobacco-free standard is the one to seek to attain. So, Josh, is it possible to show that?
I'm getting it up right now.
Okay, thank you.
And then turn around it.
I'm going to turn around it at the National Livestock of the Green Christmas. And I'm tobacco-free. I don't smoke, I don't dip, and I don't chew. Join me as we work together to get a tobacco-free Florida. For information, visit TobaccoFreeFlorida.com.
Thank you. So I appreciate that, again, on a couple of levels. It highlights student involvement, the involvement of leaders, a way to highlight these issues in a way that reaches, we hope, the community most effectively. And, kudos, hats off to Rahsaan Roberts and many others who have taken this kind of action. Next slide, please. So, a growing number, as you saw, of universities and colleges are including smokeless, or what is also called stick tobacco, in their policies. And the question is why? Because with these products, you're not dealing with secondhand smoke exposure. So what is the issue? From a public health and wellness perspective, from the perspective of culture of health on campus, it's important to recognize that these products contain nicotine. They are addictive. They are not safe. They're not safe alternatives to cigarette smoking. Most smokeless tobacco products that are mass marketed in the U.S. cause a range of cancers, from oral to esophageal to pancreatic cancer. They cause significant dental problems, gum recession, gum disease, and tooth loss. And they also increase the risk of fatal heart attacks and strokes. And you see that fatal is underlined there because it means that if one does suffer a heart attack or stroke, they're more likely not to survive that episode. And you see the images on the bottom. The two in the middle may resonate with some folks because that's Tony Gwynn, one of the best Major League ball players in history, who died in recent months, directly due to cancer suffered from his use of smokeless tobacco. And there he is during the game on the left, and then as a cancer sufferer on the right. A huge loss, with this Hall of Fame player who was also very humble and a good role model. Next slide, please. Again, going back to the industry, we often note the fact that when we deal with this issue, it's not like we're dealing with malaria. Malaria is caused by mosquitoes. But mosquitoes don't form a powerful multi-billion lobby to fight back for their right to spread malaria. But in this case, we deal with a vector. The tobacco companies are directly responsible for a lot of what we face in this epidemic, the fact that it exists in the first place. And their ads are promoting, in many cases, the dual use of smokeless tobacco products along with cigarettes. And as a result of that, in part, we see that a great number of cigarette smokers use both products. And so if you have a smoke-free policy on campus and you don't cover smokeless tobacco products, then members of the campus community may use those smokeless products to bridge those times when they can't smoke. They maintain their addiction. They reduce the reduction in smoking rates. And you end up with less impact, a good impact, but less of an impact in protecting the health of members of the community on that campus. Next slide, please. So let me just touch briefly on the issue of electronic cigarettes. It's a major new issue, but it has evolved, if not revolved, you could say, very quickly. There is a growing number of e-cigarette users in the U.S., and particularly among young people, young adults, and kids. And we see this on college campuses. So the issue there, if you go to the next slide, please, Josh, is that at this point, the users of e-cigarettes who are seeking a health benefit, they're seeking to reduce harm from not smoking cigarettes. In some cases, they're using these products to try to quit. They are the Food and Drug Administration and other authorities like the World Health Organization have made clear, really serving as human guinea pigs. And the reason is that the science is still not fully developed. These products are unregulated. That's significant. There is no standardized approach to the making of these products. There is no standardized quality control. And we know that the emissions from e-cigarettes contain some human carcinogens, in other words, cancer-causing substances, toxins, and nicotine. And so second-hand exposure is also of some concern there. Now, at the same time, if we go to the next slide, we know that the cigarette companies are marketing heavily to kids, and they are also sending messages to older smokers, encouraging them, in essence, to continue on with their nicotine addiction. So, in other words, why quit? Switch to this e-cigarette. They also are encouraging the use of electronic cigarettes in places where smoking is prohibited, thereby circumventing and watering down the greatly growing number of smoke-free policies that we see all around the country now, in public places, in restaurants, in bars, on campuses, and many other places. Next slide, please. And for these kinds of reasons, a growing number of campuses are covering e-cigarettes in their policies. They recognize that these are, as some people are now calling them, nicotine sticks. They're drug delivery devices that are derived from tobacco. They emit fine particles that pollute the air, and they are inhaled. They contain nicotine, carcinogens, and toxins, as I've noted. And if they're exempt from campus smoke-free policies, they can confuse the enforcement of these policies. They can even send a pretty clear message of sort of renormalizing smoking, which has been, as we say, denormalized for so many years now, and is threatening to roll back some of that social progress. Next slide, please. I won't spend time going through the numbers, and I understand that everyone will get copies of these slides, but the bottom line that we're seeking to show here is that smoke and tobacco-free policies work. They are effective. They demonstrably reduce cigarette smoking rates among students, among staff and faculty. They demonstrably protect members of the community from exposure to secondhand smoke. And as I'll touch on in just a moment, they also help clean up the environment because immediately after these policies go into effect, they become much less, I should say, cigarettes, but litter becomes much less visible because it's simply not being left behind the way it had been before. So if we can pass by the University of Michigan slide and take a look at the cigarette litter slide, Josh, that would be great. And by the way, let me refer everyone again to the TFCCI website, where we have all of these data and more supporting documents, including peer-reviewed research that we link to directly, and it's there at your fingertips to be used in any way that would be helpful. So as we highlight here, cigarette litter is not just a nuisance. While an individual cigarette butt may be very small, when 5.6 trillion of them are dumped into the global environment annually, you're talking about the number one source of environmental degradation on the planet. They, like unburned cigarettes, contain nicotine, pesticides, and other chemicals. They're the single most commonly collected waste item found each year and cause beach cleanup. A substantial amount of collected litter from roads and streets. They are effectively not biodegradable, and this is of great concern to many students among the rest of us, about 18.5 billion trees are destroyed every single year for tobacco production. The ramifications of this industry in this environmental sense are really significant. Next slide. And so campus policy, which we do have control over, reduce cigarette butt litter. Researchers at the University of North Carolina, by the way, in the heart of tobacco country, but where we have made a huge amount of progress in this area, concluded in their research that when you have 100% smoker tobacco-free policies, it reduces cigarette butt litter. You're building entrances compared to those campuses who don't have strong policies. And they found in this particular study that 77% fewer cigarette butts were found on the campuses studied who had these 100% smoke-free campus-wide policies. Next slide. There are also economic benefits. The bottom line is important to everyone, and while it isn't the primary reason for this campaign and our work, it's significant, and so folks should be aware of it when considering what to do, and also as part of your efforts in terms of presenting the data to decision makers. Campus policies that eliminate cigarette smoking and in many cases other tobacco use reduce employee health care costs, increase employee productivity, this is well understood, reduce costs and the work involved for grounds and building maintenance, and also reduce the fire risk to buildings and grounds. Next slide. Some of the newest data in this area has just been published in the journal Tobacco Control, confirming what we understand in this area. The peer-reviewed paper finds that the best estimate of the annual excess cost to employ a smoker, and of course all colleges and universities are businesses in a sense, is $5,816. And they found that employees who smoke impose significant excess costs on private employers. The results of the study may help inform employer decisions about tobacco-related policies. Next slide. And so let me just conclude with this for now by quoting our Acting Surgeon General, Boris Lushniak, who is our key leader on this issue and all things related to combating the tobacco epidemic from the Department of Health and Human Services, who said recently, "We are optimistic that by working together to encourage implementation of comprehensive tobacco-free policies at universities and colleges across the country, we will accelerate the progress that has already been achieved." And that is what we look forward to doing with all of you. And again, thank you for your time.
Thank you so much, Cliff. Just as a reminder, please, if you have any questions, to enter them into the chat box in the webinar software. Hopefully you've been able to understand some of the background as to why we're focusing on historically black colleges and universities and college campuses in general, from what Captain Martin and Cliff Douglas have just gone over. And now I want to talk to you about what you can do through our Tobacco-Free College Campus Initiative Challenge. And it says right there on the page, on the side, that this is a tiered recognition framework for colleges to get recognition and to structure your work as you go smoke or tobacco free. And we hope 100% smoke or tobacco free. So we'll go into it briefly. I just want to highlight that on this page you can see the URL right there, tobaccofreecampus.org/TFCCI-challenge. You can find out everything you need to know about the challenge on our challenge page, including how to sign up and where to sign up right there. Just so we all have a better understanding, I want to go over the types of campuses that are common today. You might have heard of these terms before, but just so everyone understands, a partially smoke-free campus is one that still allows smoking on campus. Many of your campuses that you represent here today are probably a partially smoke-free campus. If you allow smoking within 25 feet of a building or in designated smoking areas, you're considered a partially smoke-free campus. What we want is at least 100% smoke-free campus, and that's exactly what it sounds like. You don't allow smoking anywhere on campus. It prohibits smoking in all forms, indoors and outdoors. 100% tobacco-free campus takes that to the next level. And really, as Cliff pointed out, tobacco use is still a very serious issue. And so by enforcing a 100% tobacco-free policy, you create a very consistent, loophole-free policy for your campus. So in our challenge, your goal would be to quite simply implement a smoker tobacco-free policy, and you can do this through our various tiers. We start at the bronze level, which you would commit your campus to signing up to completing 2 actions over the next year to maintain your status in the initiative. Some of those actions are listed on this slide. It can include much more than this. And when you sign up on the form, you'll see that you'll have the option to choose several different options, but I'll just go over a few right now. Because we feel that these are the basics, the introductory level actions. Forming a campus tobacco task force. This is probably step number 1 that everyone should do. You want to divide labor up between people who are interested in implementing this policy and working together. Division of labor always helps when trying to accomplish something great. Assess tobacco-related issues on campus. You want to know that what you're doing is going to fly on campus and that people will agree with it. So survey your students, survey your administration, your staff, and your faculty, and find out if they're currently smoking, or if they plan to smoke, or if they used to smoke, and what are the attitudes towards implementing a smoke-free policy. We're working on creating a standard survey that you can issue to your campus in the near future. And then take that information and with your task force, develop an action plan. Work with your partners to determine what a reasonable timeline is and what your next steps are. These are just some of the basic actions that you can commit to, and you would be considered a bronze level campus. I also want to highlight that bronze level campuses and silver level campuses will not get certificates. You get a certificate of recognition from this challenge, which is what it's all about, when you implement a policy. So these are just intermediate steps to getting to that policy to help you structure your work. A silver level campus is an intermediate one. You have the basics in place, and you should start preparing your campus for the implementation of a policy. So you do things like campus education. You will inform and educate your campus about the need for a policy and the benefits of implementing a smoker tobacco-free campus. A lot of the information that Captain Martin and Cliff went over before would be very beneficial for your general campus populations to know about. So get that information out there to them. There are different ways you can do that, including the second bullet point, drafting a policy and promoting it on a website or web page. Once you have that policy in place, a lot of campuses choose to use a website or a web page. We highly recommend this. It's a one-stop shop for campuses, students and campus populations to find out what's happening on their campus and to know exactly what the rules are, where you can smoke and where you can't smoke. And perhaps one of the most important parts of this is establishing and promoting smoking and tobacco cessation resources on campus. You want your students to know that you're on their side. You want to help them quit. You don't want to just force them to give it up cold turkey. So help them and provide them with cessation resources. You can choose to offer counseling classes on your campus, or you can promote some of the other resources that are available. Smokefree.gov is one of our federal websites that helps people quit. 1-800-QUIT-NOW. And, of course, many local partners like the American Lung Association, the American Heart Association, etc. These are the levels of campuses that you would get recognized for it. Once you've implemented either a smoke-free, 100% smoke-free policy, or 100% tobacco-free policy, you would become either a gold or platinum level campus. So that is exactly what it sounds like. If you prohibit smoking from anywhere on your campus, you would get a gold campus certificate. If you prohibit tobacco use anywhere on campus, you get a platinum level campus. And there's a little note at the bottom. If you already have a policy, for example, or if you write a policy that does not meet 100%, but has 1 or 2 exemptions that are not up to snuff, no pun intended, please note that you'll be left at the silver campus designation, and we'll work with you to bring you up to gold or platinum. And I'm happy to answer more questions about this later on. Cliff talked about e-cigarettes. We're keeping up with the trends, and if you implement a e-cigarette policy that's consistent with your 100% smoker tobacco-free policy, you can get a plus designation. This would be a gold campus plus or a platinum plus campus. It's just like it sounds. It would be a campus that prohibits e-cigarette use anywhere that you would prohibit smoking or tobacco use. I do want to just go over the exemptions really quickly. We have our partners at the American Non-Smokers' Rights Foundation. They've come up with a very strict policy on what is allowed and what is not allowed in a 100% smoker tobacco-free policy. We like to follow their criteria because it's so strict. So these are the only allowable exemptions on campus: the use of tobacco in your own vehicle, in a religious ceremony, or in a research laboratory setting. So if you allow it at a tailgating event or some other event, this is not a permissible exemption. So you would, if you were to apply with some sort of exemption like that, you would be left at the silver level campus. Just as a explanation in advance. So that's all I have for you on the challenge itself. Please visit our website at tobaccofreecampus.org and find out more about the challenge at tobaccofreecampus.org/TFCCI-challenge. Next up, we have Scarlett Stiles to update us on the HBCU Legacy Steering Committee. Scarlett, are you on?
I'm on. Thank you so much, Josh. Hello, everyone. I'll be very brief. I just wanted to provide an update. First, I'll start by telling you a bit about the Legacy Foundation. Legacy is a national anti-tobacco foundation that runs the public youth education program, TRUE, and also targets priority populations to focus on the disproportionate toll that tobacco takes in these communities. And so one of our key initiatives this year and for the next several years is really targeting HBCUs to get campuses to go smoker tobacco free. We've working closely with
I'm going to write up some state questions because it doesn't look like we have any. I'll do one for you maybe on
a couple other partners that are interested in this. The AfricanAmerican Health,
Sure. You have answers for me?
And the National African-American Tobacco Prevention Network, and last but not least, the Medicine for Tobacco for Living.
Be sure to mention our website to sign up for the challenge, but also to contact you, and I have your information.
Provide technical assistance and help schools go tobacco free. There are 185 federally recognized HBCUs in the U.S., and as Josh and Chris have both mentioned, the Americans for Non-Smokers' Rights group actually counts the number of schools that have official tobacco or smoke-free campus policies. So of those 105, there are currently only 20 HBCUs that are represented on that list. We'd like to work with HBCUs to bring that number up dramatically. And so what our goal is to begin sometime late this year or early next year to establish a grant program, and we'll be issuing grant announcements and request applications, and these grants will provide $5,000 a year over 3 years to really help campuses create smoke-free campus or ultimately tobacco-free campus, which is our ultimate goal. So I will obviously be able to get all of your contact information from Josh, and once we're ready to announce the grant, I'll make sure that everyone on this call is aware that you can apply, and we would love to work with you. So I will end it at that. Thank you.
Thank you so much, Carla. We're going to open it up to question and answers. We have just a few questions, but before I go to the online ones, are there any questions on the phone? Okay, I will then go to our first online question, which is directed to Captain Martin. Captain Martin, what are the next steps for HBCUs right here in Region 3?
One of the goals that I have as a Regional Minority Health Coordinator and also a member of the HBCU Steering Committee that is partnering with American Legacy, I am planning to convene a conference within the next year to bring all of the 17 HBCU leaders who are working on policies to become tobacco smoke-free by 2017, which is our goal. To have that discussion, get your feedback, hear what your concerns are, what your challenges are, so that we can be organized in trying to address and provide responses to the needs that you have as you seek to implement these policies. Also, I am looking to meet with a number of our other partners, HBCU partners beyond Maryland, many of whom I've already met with, to come and have a face-to-face to sit down with you and talk about some of these challenges that you may be facing, which I'm clearly excited about the feedback that I've gotten, but I'm also aware of the challenges that you may be facing, some of which can be addressed through the Legacy Grant Program, HBCU Grant Program that we will see later on this year. So I'm looking forward to this, and I don't want to wait until we actually will announce the HBCU Tobacco Summit for our region, because I'm not sure exactly when that will take place, but I'm hoping it will take place within the next 6 months or so.
Thanks a lot, Captain Martin. I'll give one more shout out for anyone who has a call on the phone. Okay, Cliff, I have a question for you, and then I guess we'll wrap it up. An individual concerned about compliance on a campus that is separate from enforcement. They don't want to use security. Do you have any suggestions for how you can improve compliance to a smoker tobacco-free policy without fining or enforcing strictly?
Thanks, Josh. Yeah, I'd be happy to comment on that, and thank you to the question who raised this issue. There are various ways that campuses enforce these policies, and it really depends in part on their own cultures. A few campuses, I think, percentage-wise, use more stringent enforcement policies using their campus security, police, and the like. But that's kind of the rarity. Much more common is the kind of thing that we do at the University of Michigan and many campuses do, which is what some people have termed enforcement light. It's to take a respectful approach, non-punitive, to inform the community of the policy when folks are encountered who may be violating the policy, standing somewhere on campus and smoking where it's not allowed. In some instances, we're starting to do this at Michigan. The University of Kentucky pioneered a process called the ambassador system, where a group of students and some faculty and staff actually receive some training to go out and engage directly person to person in very respectful ways, providing information, and where folks are interested, providing information about cessation options on campus, but generally letting those who might be in violation of the policy. We use the tools of communication, the campus newspaper, social media, other ways of reaching the campus community. And so it's largely through education, raising awareness, and also generally through the process of developing the policy in the first place. Engaging in forums and whatever opportunities are at your disposal to have discussions with members of the community. This can be done through town hall meetings, through online events, much like the webinar that we're doing today. But making sure that everyone is heard from, including those who might be skeptical, or even in some small, instances in opposition to the stronger tobacco or smoke-free policy. But engaging in this dialogue where the kind of information that we've been sharing today is provided, and people understand the critical reasons behind the adoption and implementation of these policies. In a sense, that's all part of enforcement and compliance, because it's all about gaining buy-in and doing it in a respectful way to gain adherence and the cooperation of the community.
Thanks, Cliff. I also just want to chime in and say that if you sign up for the Tobacco Free College Campus Initiative Challenge, We will work with you and help you develop strategies to come up with effective enforcement and compliance specific to your campus, and referencing a lot of the stuff that Cliff had just mentioned before. I do want to take the time to thank everyone for joining us on this webinar. We're going to archive the slides and put them up on our website at tobaccofreecampus.org. We'll send an email out with that information as soon as we have it. If you have any other further questions, feel free to email me at joshua.prasad@hhs.gov. If your questions are specific to your Tobacco-Free College Campus Initiative. If they are specific to minority health in general, do not hesitate to contact Captain Elijah Martin at elijah.martin@hhs.gov. Just another shout out to our social media. Please like and follow us on Facebook, Instagram, Twitter, Tumblr. Thanks again, everyone. We look forward to working with you in the near future.
Thank you.